Hello, Enid. I'm Derek Salas, the Director of Communications for the City of Enid, and
I'm Diana Hernandez, Communications Assistant.
And with us today, we will have Ray Johnson of Garfield County Health Department, and I think Maggie will be joining also.
Hopefully, yeah.
Okay. Can you update us on the number of cases for COVID-19 as far as the health department goes, as far as recoveries, deaths, and what have you?
Sure, yeah. I'll do a quick screen share and share with you guys. So this is from the Oklahoma State Department of Health website, and this is just a case summary. So as of today, there are total 3,121 cases in the state of Oklahoma, 188 deaths, and 1,961 of those cases are recovered. And we have a summary for the United States there. And then for the county, so in Garfield County, we've had 11 total cases since testing began, 1 death and 7 recoveries. And this even breaks it down for Enid. So Enid has had 9 cases total, 1 death and 5 recoveries. So that puts us at what, 3 active cases? So that's just a quick update. Again, the Oklahoma State Department of Health website has a ton of information, and it's open to everyone to look through.
Okay.
And share. And I will try to stop sharing my screen and not jump out of this conversation. I don't want to kick it. Okay, there we go.
Very good.
Now, Ray, so the Garfield County Health Department is open to the public. Now, are there still going to be the same restrictions in place? A lot of businesses are having a soft reopening with the announcement that the governor made for the reopening strategy plan, and also the mayor is going to announce his Monday for Enid. But is the Garfield County Health Department have a reopening plan, or just maintaining these restrictions, I guess?
Yeah, we have been open. We're still open. We are triaging up the door, which is something that, you know, a lot of businesses could do very easily. We have someone sitting at all hours of business, sitting at the front door, and we're masked, and we ask, you know, if they're running a fever, have a cough or shortness of breath, and you know, if they're not experiencing symptoms, they're welcome to come on in. And if they are, then we ask them to go to the car and then call, and then we can do some testing if that's what they would like to do. But we're still offering all of our services. For WIC is a huge service that we offer here, and it's a great service, and that can actually be done online now.
Okay. So I imagine you're saying that things really won't change as far as your procedure right now?
No, right now, because things are opening, we're going to probably see some cases pop up, and it's still important to, you know, just because things are opening doesn't mean the virus is gone. So we still need to be careful. We still need to not let those people that are experiencing symptoms need to stay home and stay in their cars and not enter the facility.
Okay. I know the Garfield County Health Department works in various areas when it comes to health for the community. Are you collaborating with restaurants on reopening strategies?
Yeah, the state has provided guidance for restaurants reopening, and that's just a lot of extra disinfecting and some other measures. And we're actually creating a Facebook group. It's called Northwestern Oklahoma Healthy Businesses, and that's kind of an information share where all businesses can access images and, you know, posters for their windows and specific guidance on how to disinfect your facility, and special guidelines for, I think we're going to have restaurants, salons, barbershops, churches, and kind of any request that we get, we're going to try and make sure we can provide guidance for that. But yeah, so we want to partner with as many businesses as we can to make sure that they remain healthy.
So that is great. So you are collaborating with other businesses this Facebook page. Now, if a business is interested and hasn't been contacted, especially a small business, how can they contact you so that they can be a part of that page and get all the useful material that is on that page?
Sure. It's if you visit the Garfield County Health Department Facebook page, it's actually, you just push a button right there and it'll connect you to that page, and then you just request to be added. And I actually just created the page this morning, so I'm working on ways that I can advertise it and make it easily accessible for people. But it's ongoing, and we hope that it's a place that people can ask questions. You know, if they need something for their business, then if it's not listed there, we can find it. And another thing that we're going to add in there is some services we can offer. Like, we can offer some hand washing courses. We can do those virtually, and some other things like that. So it's a good resource for businesses reopening and just keeping the spread down.
Okay, very good. I know the economy, by the economy, reopening, as far as the state and the community, it's going to be a lot of changes. Will that be any changes in the testing process or the level of testing, and whether or not will Enid begin doing testing for antibodies?
Sure. So as far as testing goes, we have the capacity to test. The requirements are going to stay the same. We do expect to see, you know, a little bit of an increase of cases when things reopen. It's kind of an inevitable. Sorry. But we're capable. That's one of the, you know, one of the requirements to be able to reopen is that, you know, our healthcare system, one, is ready for it. So we have the ventilators, we have the PPE, our healthcare system is not overwhelmed. We have the capability to test, and we have the capability to do contact tracing. So we're ready. We can open, and so our testing procedures will not change at this time. But again, everything is constantly changing. So if there were a need, it would change. But at this point, there's no plan for that.
Now, public health does the testing and does the contact investigation. Now, will the reopening of the economy make
Let me mute that. I'm sorry.
Yeah, no problem. This is live, so
I'm so sorry.
This is totally okay.
It's here. So you're asking about contact tracing?
Yes. Will it be more difficult when the economy is reopened to be able to, on the contact investigation, to be able to pinpoint who has been contacted or came into contact with COVID-19?
So that's one of the things that the health department really excels in. That's our job, is to contact trace. It will make it more difficult, but we have an infectious disease team that's what they do. And, you know, this isn't our first time doing it. We do it for other diseases. So we feel capable that we'll be able to keep up those procedures.
Okay. The governor gave his 3-phase plan for reopening the state. And he said in his plan that some businesses can open today in cities that have less regulations, not as strict. Does this align with what the State Department is doing? Would the State Department align with that plan?
Yes, I would say yes, because we are prepared. We can test. We have all the staff and the equipment that we need, and we can contact trace. So we're ready. We're ready to take care of Enid.
Okay, great. Well, I do not have any relative questions on Facebook. Do you have any other questions that you...
Okay.
Ray, do you want to share anything with our viewers before we go?
Derek, you did ask about the antibody testing, and I forgot to answer that.
That's right.
And we don't, I know the state did their first round of the testing, and Enid was not selected. We don't have a say in that. We would love to do the testing. But at this time, it's still pending. We're still waiting on it. I think privately it may come before it comes through the state, but that will be exciting when that does come through. And what, did I have anything else to add?
Correct.
No, just to, even though things are going to still open, it's still important to protect those vulnerable populations, to still try and stay home, wash your hands, sanitize your doorknobs. If you're going back to work, wash your hands when you get there. Really be disinfecting those surfaces, because the virus isn't gone. We just feel that it's time to reopen because we have such a low number of cases that, you know, we can do it safely, but there's still a chance of people getting sick and there's still a chance of outbreaks, so we still need to be careful.
Okay. Very good. Well,
Okay.
we thank you for joining us today. Thank you for the weekly update. Tell Maggie we missed her.
I know. Yeah, she's probably gonna pop in any second now.
Okay. Well, and Enid, we appreciate you for coming. Weekly, you can come here on Fridays and get an update from the health department. And Monday through Thursday, Monday is usually the city manager or mayor. And Tuesday, Wednesday, and Thursday, we'll have some business or some organization within the community to come. And sometimes the hospitals or what have you to talk about what's going on in that area. So we appreciate you Monday through Friday. Remember to join us 1:30 p.m. Thank you.
Thank you.